AAPC CPC Model Paper Chapter number 9. This chapter includes the CPD code series of 30,000 codes. The 30,000 series of CPD codes focuses on the surgical procedures performed in the respiratory system, the cardiovascular system, the hemic and lymphatic system, and the mediastinum and the diaphragm. 30,000 series codes. Question number 1. A patient in cardiac arrest had to be intubated with an endotracheal tube during advanced cardiac life support treatment. What procedure code would you use for this emergency ET tube intubation? So there are 31,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
In this question, it's a straightforward one. There is a emergency endotracheal tube intubation. So when you see the codes, 31,000, 420, 500, 502, and then 505. So these all three codes are nearby codes. So you can guess the answer should be within these three codes. So you can use the elimination method to find the answer. So let's directly go to the code. Okay, when you go to the code 31420, it says epiglotticectomy. So that is not suitable here. 31500, it is intubation endotracheal emergency procedure. So that is exactly describe the procedure. So the answer should be intubation endotracheal and emergency procedure. So other answers you can see 502 tracheostomy tube, 505 laryngoscopy tube. So the correct answer is B. So if you encounter the situation in a real working scenario, you have to use the alphabetic index. So go to the CPT box alphabetic index. There you can search for intubation. Then you can find the sub-index endotracheal tube. It leads you to 31,500. You can go back and check the tabular list. Similarly, there's a direct code. When you go to the endotracheal intubation, you can see emergency 31,500 or endotracheal tube emergency intubation 31,500. So by using index also, you can directly find the answer. Question number 2. A 50-year-old patient with stage 3 non-Hodgkin's lymphoma underwent a surgical procedure to obtain a biopsy of enlarged cervical lymph nodes identified on a PET scan. Enlarging lymph nodes 3 to 3.5 cm were identified deep to the ligated external jugular vein following an incision in the supraclavicular region and dissection through the platysma muscle. One of these nodes were excised after sequential clipping of its hilar vessels. Which CPT code best describes this surgical excision of deep cervical lymph node? So there are 4 CPT codes from 20,000 and 30,000. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is stage 3 non-Hodgkin lymphoma and biopsy of enlarged cervical lymph nodes done. So here the biopsy, one of these nodes, not all, only one of these nodes were excised after sequential clipping of its hilar vessels. So here you can see 21,550, other codes are 35,720, 510 and 520. So you can use the elimination method to find the answer. So you can go directly to the codes. So you can guess that this 21,550 is an outlier. So this 38,000 are most probable answers. So once you check the codes, 21,550 is biopsy soft tissue of neck or thorax. 38,720 is cervical lymphadenopathy complete. But in this case, only one lymph node is removed for biopsy purpose. So that is not suitable here. So 38,500 is a biopsy or excision of lymph nodes open superficial. 510 is open deep cervical node. 520 is open deep cervical node with excision scalene fed pad. Here, one of these nodes was excised after sequential clipping of hilar vessel. So there's no muscle or fed pad removal. So the correct code is 38,510. That is open deep cervical nodes. So the correct answer is C. So if you encounter this case in a real working scenario, you have to go with the index. So once you go to the alphabetic index, go to the biopsy, then go down to lymph nodes, again go down to open. Once you go there, it will suggest following 6 codes. Again, you have to go back to the tabular list and you have to verify the codes. So once you verify, you will find the correct answer is C, that is 38,510. Question number 3. A patient with a history of deep vein thrombosis is prescribed a Vena Cava filter. The physician inserts the filter via a femoral vein approach with ultrasound guidance. What is the appropriate CPT code? There are 37,000 code series available. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
So here you have to highlight this is a deep vein thrombosis. Here prescribed Vena Cava filter that was inserted through femoral vein approach with ultrasound guidance. When you see the answers, all answers are adjacent answers. So you can use the elimination method to find the answer. So go directly to the codes. So when you go to the code, the 37191 is insertion of intravascular Vena Cava filter endovascular approach, including vascular access, vessel selection, and radiological supervision and interpretation, interprocedural road mapping, and imaging guidance, that is ultrasound and fluoroscopy when performed. So here you can see the deep vein thrombosis inside the femoral vein approach. The femoral vein approach is the endovascular approach. So that is correctly described the procedure. So the correct answer should be 37191. If you see other answers like 37192, that says about repositioning of the intravascular Vena Cava filter. That is the repositioning of already inserted intravascular Vena Cava filter. So that is not suitable. So the correct answer is A, that is 37191. If you check the other answers, 37193, it says about a retrieval, that is removal of the intravascular Vena Cava filter. So that is not suitable. 37195 is thrombolysis, cerebral by intravenous infusion. So that is not relevant to this case. So again, the answer is 37191. If you encounter this case in a real working scenario, you had to find the answer using the CPT alphabetic index. So in the CPT alphabetic index, you have to go to the Vena Cava filter. Again, you will find the subcategory of insertion. So that will lead you to the code 37191. Again, you go back to the tabular list and confirm the answer. So the answer will be A. Question number 4. A 3-year-old boy presented to the pediatrician's office after the patient's mother discovered that the boy had inserted a jelly bean into his nose. The mother, when trying to remove the jelly bean, ended up pushing the bean further into the patient's nose to the point that it is no longer visible. Upon presentation, the patient was extremely agitated and anxious and was experiencing pain and swelling in the left nasal sinus. The pediatrician determined that due to the patient's emotional state and the depth of the jelly bean, the patient would have to be anesthetized to remove it. The pediatrician admitted the patient into the hospital and performed the removal of the foreign body under general anesthesia. At one point, a lateral rhinostomy was considered but ruled out. The physician was finally able to grasp the foreign body. How should we code the CPT code for this service? So there are CPT codes available. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to note that the patient initially admitted or visited to the pediatrician's office. After that, the pediatrician assessed the patient and decided to go for the foreign body removal under anesthesia. So there are two scenarios. One, the patient encountered in the pediatrician office. Then the patient have been admitted to the hospital and foreign body removed under anesthesia. So when you see the codes, you can see there are two codes used in the answer. One is 99 series, that 99214 and 99392. Other code is 3310 and 3320. So let's use the elimination method to find the answer. So let's go to the 99 series. So here you can see the 9924 says office or other outpatient visit for the evaluation and management of an established patient which requires medically appropriate history or examination and moderate level of medical decision making. So that is the exact scenario here in the patient's encounter. If you see other answer 99392, that is a continuation of the 99391, that is periodic comprehensive preventive medicine. So that is not relevant to this case. So you can omit that answer. So here you can use 99214 as the first code. So this is for the evaluation and the management part. When you see the 3310, that is the removal of foreign body. Here 3310 is requiring general anesthesia 3320 is by lateral rhinostomy. But here in this case, the lateral rhinostomy is considered but not done. Here you can see at one point the lateral rhinostomy was considered but ruled out. So that is not done. So as it is not done, the suitable code here is 3310. So 299,214 at 3310 is the suitable code. So here the two encounters happen. One, the patient admitted to the pediatrician office, then patient admitted to the hospital. So the modifier 57 has to be added. The modifier 57 is decision for surgery. That is an evaluation and management service that resulted in an initial decision to perform the surgery may be identified by adding modifier 57 to the appropriate. So the correct answer is A. So if you encounter this case in a real working scenario, you have to find the answer using the index of the CPD book. So when you use the index of CPD books for the initial encounter in the pediatrician office, you have to go to the CPD index and go to the evaluation and management services. Then you have to go to the office or other outpatient visit. Then you have to find the established patient. There are 99,211 to 99,215 code series. So go back to the tabular list and you have to find the answer. For the second part, go to the removal of the foreign body. Again, you can find the code removal foreign body intranasal office type procedure, and 3310 requiring general anesthesia. So this 3310 is the suitable code. So the answer is A. Question number 5. A physician performed a resection of the diaphragm utilizing an autogenous free muscle flap. What is the correct CPT code? So there are 39,000 code series are there. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight that this is the resection of diaphragm and also the repair done using autogenous free muscle flap. So when you see the codes, all codes are adjacent codes 39,000, 540, 541, 60, 61. So you can use the elimination method to find the answer. So directly go to the codes. So when you go to the codes, 39,540 is repair diaphragmatic hernia. But here this is not the repair, this is resection of the diaphragm. So this is not suitable. 39,541 that is chronic, so both answers are not suitable. When you see 39,560, resection diaphragm with simple repair. Example, primary suture. That is 560. 561 says with complex repair. Complex repair means prosthetic material, local muscle flap. So in this case, you can see autogenous free muscle flap. That is autogenous means this is local muscle. So the answer should be 39,561. So the correct answer is D. If you encounter this case in a real working scenario, you have to use the index of the CPT code. So go to the CPT code index, go to resection. In that you have to go to the diaphragm. It will lead you to the codes 39,560 and 61. Again, go back to the tabular list and confirm the answer. So the answer is D. Question number 6 of 30,000 series codes. A cardiovascular surgeon implanted a temporary pacemaker system in a patient with cardiac arrhythmia. The implanted system contained transvenous dual-chamber pacing electrodes. What is the correct code for the procedure? So there are 33,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Question you have to highlight this is a temporary pacemaker and the transvenous dual chamber pacing electrodes. So if you want to know what is the difference with the temporary pacemaker and the implanted pacemaker, normally the temporary pacemakers are fixed outside. So you can see here, this is the external temporary pacemaker, that is generator box, and it go inside the body through the pacemaker lead in the subclavian vein. Through the subclavian vein, it go to the right atrium and the lead go into the right ventricle. Here you can see the temporary pacemaker lead. For the right ventricle, it generates the electric pulse. You can see the implanted pacemaker. You can see the pacemaker implanted under the skin. You can see by surgery, the pacemaker is inserted under the skin. It is generating the pulse. You can see the pacemaker lead is go through the subclavian vein to the right atrium to the right ventricle. Here you can see the pacemaker lead. It generates the pulse and heart pumps. So this is how the temporary and the implanted pacemakers are fixed. So you can use the elimination method to find the answer very quickly. So directly go to the codes. Okay, when you go to the code, you can see the 33,210 code is insertion or replacement of temporary transvenous single chamber cardiac electrode. But this is temporary, but the transvenous dual chamber pacing electrodes. But 210 is only the single chamber cardiac electrode. So that is not suitable. When you see the other answer, 33,211, insertion or replacement of temporary transvenous dual chamber pacing electrodes. Separate procedure. So this is the suitable answer. If you check other answers, 2016, that says insertion of single transvenous electrode, permanent pacemaker. But here it is temporary. So this is not suitable. 2017 also insertion of two transvenous electrodes, but permanent pacemaker. So in our case, this is a temporary and dual chamber electrode. So that is 33,211 is the suitable answer. So answer B is correct. If you encounter this case scenario in a real working world, you have to go to the index of the CPT codebook. So go to the index, go to the pacemaker. There you have to go to the subcategory of pacemaker system with leads. Again go to the insertion, then electrodes. There you will find the codes 33,202, 203, 210 and 211. Go back to the tabular list and you can find the answer. So the correct answer is B, that is 33,211. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.